Thank you so much for coming today to listen to a discussion about spaying and neutering our companion animals, dogs and cats. Just wanted to give you a little bit of introduction about what I do at the ASPCA. My title is Senior Director of Spay Neuter Programs and Grants. And basically, I'm in a department called Veterinary Outreach, and we try to interact with veterinary students, which we're doing today, veterinarians and shelter professionals to educate them about shelter medicine and related issues, such as spaying and neutering, feral cat issues. And our department is composed of Dr. Lila Miller, who's the editor of the second edition of the Shelter Medicine book, Dr. Miranda Spindell, whose focus is infectious diseases, Dr. Stephanie Janesco, who is in New York City, and her focus is also infectious diseases and shelter management, and myself, who obviously I focus more on spay neuter issues. So before I came to the ASPCA, I was very fortunate to have run a mobile spay neuter clinic, and I also help Buffalo, New York. That's where I'm from. Oh yeah, that's pretty interesting out here in Wisconsin. We set up Operation Pets, which is a Humane Alliance model clinic, spay neuter clinic that was set up in 2008. So my experiences are mostly with mobile clinics and stationary spay neuter clinics. Okay, so what year are you all in veterinary school? So first through third? And so you have not yet had any surgical experience, or some of you have had surgical experience? Okay. So the presentation today deals a little bit with surgery, but because I predicted that we'd have a variety of veterinary students, it deals a lot with the process of spaying and neutering and how we can maintain high quality in those high volume settings. So where are we going to go today? We're going to discuss the benefits and detriments of spay neuter, medical guidelines that we put into place in terms of standard operating procedures, some complications that can occur after the surgery, and we're going to spend some time with discussing the various program models for delivery of spay neuter services, some training opportunities for veterinary students, and a little bit about non-surgical sterilization as an alternative to spaying and neutering. So first, reasons to spay and neuter. And definitely there are individual animal health benefits, which include decreasing the risk of mammary gland tumors in both female dogs and cats, decreasing the risk of prostatic enlargement in male canines. Obviously, if we remove the reproductive tract, we eliminate the risk for ovarian and uterine cancer, for pyometra, and for testicular cancer. And specifically for male cats, they have a decreased tendency to roam to find mates if they are neutered. They have a decreased tendency to fight with other males to find a mate, and they have decreased spraying and urine marking. So that's some benefits specifically for male cats. A really great summary article regarding the benefits and detriments of spay neuter is written by Dr. Margaret Root Kustrich, and that's Determining the Optimal Age of Gotonectomy for Dogs and Cats. And it summarizes about 180 studies that have been done on this topic into one nice, concise article. And just before I forget, if anybody wants any of the references that are listed in the PowerPoint, I have a resource guide that I printed up. It contains all the research studies that are mentioned, the websites that are mentioned, so that if you do want to look into anything in greater depth, you can get that information off the resource guide. So. Thanks. And little known fact, yes, there are possible detriments to spaying and neutering. Castrated dogs have an increased risk for prostatic neoplasia. Spayed and neutered cats have an increased risk for diabetes mellitus. Spayed and neutered dogs have an increased risk, and this is influenced by the breed of the dog, for cardiac and splenic hemangiosarcoma and also osteosarcoma. But super important when we're evaluating studies that compare the risks for certain conditions in spayed and neutered animals with intact animals, it's definitely important to look at the incidence of those diseases in each population. And this is just an example of this. In female dogs, the incidence of Pyometra is about 15% by the time the female dog reaches age 4. And that increases to about 23 to 24% by the time the female dog reaches the age of 10. And then if we look at the flip side, hemangiosarcoma is the most common cardiac tumor in dogs with a reported incidence of 0.2%. And there is a breed predilection here. And it is reported that spayed females reportedly have 5 times the risk of cardiac hemangiosarcoma compared with the risk for sexually intact females. But if you say 5 times the risk, 5 times 0.2%, that's still a whole lot less for a female dog than for that female dog to get pyometra by the time they're either 4 years of age or 10 years of age. So we constantly have to look at these studies and balance the statistics that we're getting from them. And we say that the decision whether or not to surgically sterilize an individual animal is best made via an educated conversation between a pet owner and their veterinarian. And certainly we recognize that even more studies are necessary to clearly determine the long-term effects of spaying and neutering. So now we're going to switch to talking about medical care guidelines for spaying and neutering. And this started with a task force that was developed by the Association of Shelter Veterinarians. And they ultimately came up with a document that was published in JAVMA. And that document can be viewed at the Association of Shelter Medicine's website. And this was in 2008. But in order to more fully tell this story, we have to back up even to 2006, where 22 veterinarians met to address the need for increased capacity and a consistent level of care within spay-neuter programs. These veterinarians recognized that there were lots of spay and neuter programs popping up across the country, and they wanted to give some guidelines for how medical care could be provided in those programs. And they set many goals. Well, first they set a definition of what high quality, high volume spay neuter, what is that? And they determined that the programs are efficient surgical initiatives that meet or exceed veterinary medical standards of care in providing accessible, targeted sterilization of a large number of dogs and cats in order to reduce their overpopulation and obviously their subsequent euthanasia. And now we get to the goals. They wanted to instill confidence in the public regarding use of the spay-neuter programs, promote the acceptance of this practice area by the veterinary profession, and that was a biggie. A lot of times veterinarians in private practice, really don't understand what spay-neuter programs are doing and that they can actually do a very good job through the use of efficient systems in providing high-quality care for each patient. Provide guidance for veterinarians already involved in spay-neuter programs or those veterinarians who want to become involved in spay-neuter programs. Another biggie, provide reference for use by state boards of veterinary medicine. And also allow funding agencies to determine if spay-neuter programs provide an acceptable level of care. The ASPCA gives grants to organizations for spaying and neutering. And we look to those guidelines to say, are these practices in place? Are we giving our money to an organization that's providing high quality care for the pets? And mostly the JAVMA article, we're going to talk later about the various types of programs that can deliver spaying and neutering. And the authors wanted to make sure that these guidelines for spay-neuter programs could be implemented regardless of where the spaying and neutering was occurring. And again, this is listed on the resource guide. You can view the full article at sheltervet.org. So although this is oftentimes the way my house looks, we try not to run our professional lives that way. And from an outsider looking in, people might say, what are you doing to save time in these programs? You must be cutting some corners in order to do that large number of spays and neuters. They say that high volume must mean low quality. And I counter that with high volume leads to the opportunity for very high quality. Private veterinary practice is very good at what they do. They do a whole bunch of different things. They have all kinds of equipment to satisfy the full needs of our pet animals. But they may not be set up for doing repetitive spays and neuters the way that spay neuter programs are. And we do that by incorporating very efficient systems and also creating and promoting standard operating procedures. And every spay neuter program that I've been involved with, we've had the opportunity to go to our staff and say, what's working right? What can we possibly change to improve the quality of care that we're delivering? And we incorporate that into our standard operating procedures, which is, we're fond of saying, a living, breathing document, because that it does change as we go along. And I would counter the private veterinary practitioners who say, what are you doing? You must be cutting corners. And that if you do the same thing day in and day out, you have the opportunity to fine-tune your skills and become very good at it. So the document is really broken up into 4 sections, and it basically follows the patient through a spay neuter clinic. We are going to talk about preoperative care, anesthesia, surgery, and postoperative care. So first, in terms of preoperative care, this even starts before the patient comes through the doors. We have to have some means of communicating to our clients that we want to withhold food prior to surgery. In pediatrics, typically thought of as between the age of 6 and 16 weeks, we want them to be fed 2 to 4 hours prior to surgery. And that may mean if that pediatric patient comes through the door at 7 or 8 a.m. and they don't have surgery until 1 p.m., we might have to give them a little meal 2 to 4 hours prior to surgery so that they don't become hypoglycemic. For juvenile animals, those past 6 months of age, and adults, we recommend fasting a minimum of 4 hours. But to be realistic about that, we generally recommend that they are withheld food after midnight. We don't recommend withholding water. We want patients to be well hydrated. And we want to know, is this patient receiving any medication? Do they have any health problems? And oftentimes we can build a consent form that asks those questions of the client. So that by the time they get to us and we're reviewing the consent form with the patient, we'll have answers to those questions. And I know in Wisconsin, we have a little bit of a tweak on that, and that you guys have to actually have a conversation with the client who's bringing in the animal. So that it's good to have that information on the consent form, but also if Dr. Newberry wants to address that a little bit of what is involved with obtaining informed client consent in Wisconsin.
So the state of Wisconsin, the other one? Sorry, both, okay. So the state of Wisconsin is reasonably unique in having passed a new ordinance that requires veterinarians, instead of just to have somebody fill out a form, there is something called informed consent, which means you have to actually have a conversation with the person who's bringing their animal in. The conversation needs to be with a veterinarian. And the person has to have the opportunity to be able to ask questions from the veterinarian. It doesn't have to be in person, so informed consent can be over the phone, but it does have to be, the veterinarian has to be there so that the person can have a chance to ask questions. This is a confusing law at this point. If you actually look at the ordinance, I'm sorry I don't have the ordinance number, but if you're interested and you want the ordinance number, I can send it to you, and it actually doesn't say any of what I just said in the ordinance. It says something about professional conduct, and that's all it says. But then the licensing board has interpreted that ordinance to mean all the things that I just said. And the WVMA has made a video available for WVMA members in their members only section, where you can watch that video and they'll tell you the interpretation. It's really important to do that before you start practicing, because you wouldn't know that interpretation without having somebody tell it to you. Questions about that? I had lots, just so you know, and I asked all sorts of questions, and actually Dr. Makolinski and I both asked lots of questions of the WVMA once we saw the actual ordinance. But it sounds as though they're really taking their interpretation very seriously, and some complaints have gone forward to veterinarians who are not following sort of the rules of that interpretation.
Okay, so the next thing we're going to discuss is physical examination of the patient. Good. And this step is commonly skipped in spay-neuter programs, and people say it's because they lack the time to do it. However, a quality exam can really be performed in an efficient manner. And for cooperative animals, this should be done prior to sedation and anesthesia. For fractious animals like feral cats that come into us, it's ideal if the exam is performed after sedation, but still prior to surgery. And the veterinarian should make, obviously, the final decision on whether this patient is an adequate candidate for both anesthesia and spay neuter. And although the mission of these programs is to spay and neuter as many animals as we can, it's still an elective procedure. And if we think that an animal is not a good candidate that day, then obviously we make arrangements for them to become a good candidate in the future. So what do we do here? We want to verify. We want to look at the animal's mucous membrane color. We want to look at their hydration status, listen to their hearts and lungs. Also, check for any hernias. Check for anything that could be surgically correctable while you're doing the spay and neuter. Check if there's any external parasites, their body condition score, and any infectious disease that would preclude them as a good candidate for the day. And of course, all these things should be marked down on the medical record so that we have a record of what we did today. And at this time, sometimes people bring in animals. They think it might be a male. It's really a female. Also, shelter workers may be confused in specifying the gender of animals. So it's a good time to determine if it's an intact female, spayed female, an intact male, neutered male, or even a cryptorchid male, which is something that will have to be dealt with surgically. Also, very important to verify body weight. We're going to use that as a guide to our drug dosing for the day. And if we have to, we'll make as best of an estimate as we can in feral or fractious patients. Okay, so here's an example of a preoperative care issue. I should put this on 2 slides. The example is we're presented with a 2-year-old male cat with no palpable testicles. And the question to you is he already neutered, or could he possibly be cryptorchid? So does anybody know what we're looking at here? First of all, cat penis. And what's the difference between the one on the top and the one on the bottom? Right, so the cat penis picture on the top shows little tiny spines on the penis, and that means that the cat has a direct influence of testosterone. So that cat either has 1 or 2 testicles. And sometimes we're brought cats that have no testicles in their sac, but somehow they look to us like they're intact male cats. So then if we do see the spikes on the penis, then we know we have to go hunting for that second testicle somewhere. And it could be either in the abdomen or in the inguinal area. And the second picture shows a cat penis without the spines, and those typically regress 4 to 6 weeks following a neuter. And here's another preoperative care issue. Here, you're a veterinarian in a mobile spay-neuter clinic that visits a rural animal shelter once monthly. And today, a feline patient, domestic short-hair, 9-month-old kitty named Lovebug, presents to be spayed. And she has the following clinical signs. She's been sneezing a small amount of yellow mucus for about 3 days. She has mild, clear ocular discharge. Her appetite's good. She doesn't have a fever, and she's really very active. So our choices here, actually the shelter does indicate that they will be able to provide care for the cat if you choose not to spay and neuter her today. They don't have a formalized foster care program, so she will have to stay in the shelter. However, if she was spayed today, she could be adopted and go home with antibiotics that you prescribed. So what to do? And obviously our choices here are to have the kitty be cared for by the shelter until we return and hope that she's better and we can spay her at that time. Or spay the cat today, administer subcutaneous fluids, supportive care throughout the procedure, and put her on antibiotics. And although there's no definitive answers for these questions, and you'll come up with these situations all the time, and there's various nuances to them, we try to look at what's best for the cat in that particular situation. And if this is a situation where the cat has the option of being adopted with antibiotic supportive care being spayed, or have to sit in the shelter for another month, it may be in that cat's best interest to spay her today. And the JAVMA article that we discussed previously does have a section about the risk-benefit analysis of sterilizing patients with mild infectious or non-infectious medical conditions. In about 4 to 6 weeks, the spines disappear. And I've read that, that's been established, but I've also seen it in a free roaming cat program that we did. We tattooed the cats, so we know that we did this cat previously, and we could look up from the record and see when we did the cat. We did the cat about 2 months ago, and the cat did not have any spines on its penis anymore. Okay, here is another question that is often posed to spay-neuter programs. Should we be doing pre-anesthetic diagnostic blood testing on all the animals that come to us? And this is an interesting article that's referenced in the resource guide. And I want to make sure I got this right. It's called, "Is Routine Pre-Anesthetic Hematological and Biochemical Screening Justified in Dogs?" And basically what they did, they obtained a standardized history and physical examination in the dogs in the study. And all dogs requiring anesthesia were assigned to a physical status group, and an anesthetic protocol was determined. And then they took blood work, hematological and serum biochemistry tests were performed, and the results of the test were used to determine if any changes were to be made in the animal's physical status group or the anesthetic protocol that they chose. And in 84% of the dogs, such testing would have been considered to be unnecessary. 8% of the dogs would have been recategorized to a higher physical status category, but surgery would have been postponed in about 0.8% of the dogs. And the anesthetic protocol would have been altered in about 0.2% of the dogs. So the study concluded that changes revealed by preoperative screening were usually of little clinical significance and did not prompt any major changes to anesthetic technique. Okay, we're moving on to discuss anesthesia and pain control. Yes? Oh yeah, sure. The question was, were the dogs categorized by age? Were they all adults? Were they older dogs? And I'd have to go back and look at the paper, but to the best of my recollection, they were adult dogs. They didn't specifically categorize them into the elderly category. And I know for some spay-neuter clinics, they do require biochemical and hematological blood testing before they will accept that animal as a patient, because apparently the risk is higher in older animals for them to have problems that could be detected. Okay, so anesthesia. We obviously want to make sure that it achieves pain control. We can do that with a number of different drugs: opioids, nonsteroidal anti-inflammatories, alpha-2 agonists, and even more and more people are starting to use local anesthetic blocks. We also want it to achieve stress reduction, muscle relaxation, and unconsciousness. And these are two very important phrases. Multimodal analgesia is combining multiple pain control agents into a single protocol. And this greatly improves pain control and stress control in animals that are going to be spayed and neutered. But what you can do with multimodal analgesia is use less of each drug, because it will act synergistically and minimize the negative side effects of each of those drugs. And then the other phrase is preemptive administration of analgesics. And that's really important in our spay-neuter environment, because we want to make sure the drugs are on board and have had time to act before we actually make the first surgical incision. It's much easier to prevent pain than it is to control pain. This is a nifty little tool that we incorporate in spay-neuter programs, a drug dosing chart, which gives us the weight of the animal and the drugs to draw up, the volume of drugs that are going to be used per weight of animal. animal. And this helps to decrease the possibility for errors, and it also helps to increase efficiency in this environment. Thermoregulation, very important topic. Animals that undergo spay and neuter have potential for hypothermia. And in a lot of cases, we can do very simple things to minimize this. Instead of placing them on a cold stainless steel kennel floor, we can put newspaper or brown paper down to minimize that contact. When they're recovering from anesthesia, we can cover them with a towel. We can use a heated table or a heated blanket for surgery. But some animals, we're going to have to be more intensive about helping with their hypothermia. We can provide carefully protected contact with circulating warm water, heated containers, or even use of forced air warming devices. But we always have to be conscious that we don't want to cause inadvertent burns, so we want to limit contact with electric heating pads, blow dryers, heat lamps, and drying cages. And also avoid excessive use of alcohol, especially in pediatric patients, as a prep solution. And here's just some pictures. The upper left is the warm water blanket. Upper right is a bear hugger, and then even simple things as a colored fluid bag that could be repeatedly heated to provide an external source of heat for a patient. And these are really popular rice socks. This is oftentimes a good activity for people who want to volunteer at your clinic. We fill a sock with uncooked rice, and then that can be repeatedly microwaved to provide an external source of heat. And what we do with that, in order to keep it clean for the animals, is to put it in a pillowcase, wrap up the rice sock in a pillowcase, put it between animals so that the actual sock is never contaminated by the patient. Oh, that's great. Yep, and they feel like they're doing something really good that way, because this is definitely appreciated by the animals in post-operative period. Okay, we're moving on to monitoring for depth of anesthesia. And here we have some tools that can help us, pulse oximeters. More and more spay neuter clinics are using capnographs, which measure end tidal CO2. And we want to make sure that their pulse quality, their rate, their rhythm are adequate and do it throughout the procedure. Their respiratory rate and pattern, we want to monitor that. Their jaw tone, eye position, pupil size, palpebral reflex. Another thing if with anesthesia is we want to avoid chamber or mask inductions. They tend to be very highly stressful for a patient. They cause bronchial irritation, laryngeal irritation, and they do increase the risk for aspiration of GI contents. Another really important point regarding use of masks for delivering isoflurane and also chambers is that in a setting like a mobile spay neuter clinic, you're also really exposing your staff to an increased amount of isoflurane. So there's a difference between putting a mask on an animal to maintain anesthesia when you need to, rather than taking that animal from a sedate or fully awake state into anesthesia. And that's what we really want to try to avoid using the mask in chambers for. And we definitely have to be prepared for emergencies. I know spay neuter clinics that run emergency drills, so that obviously everything is orchestrated by the veterinarian, but then everybody knows what their role is if an emergency is to occur. Everybody knows where the kit is with all the emergency drugs, and they have a specific chart for emergency drug volume that should be drawn up for the weight of patients. Okay, moving on to surgery. You think you wouldn't have to say it, but we still find that we do have to say it, that separate sterile instruments should be used for each patient, and that includes even litters of kittens or litters of puppies. They all need their own separate sterile instrument pack. The surgeon should perform a properly performed hand and arm scrub with an appropriate agent. And the guidelines do say that the surgeon should wear a cap, a mask, and a separate pair of sterile gloves for each surgery, that a sterile gown is optional. And when I do surgery, I like wearing a sterile gown. And then I try to keep that as clean as possible. But some surgeons really do feel that they can maintain sterility on the field where the animal is by not wearing a sterile gown. and that's acceptable. Yes. Mm-hmm. Okay, yep. The question is, how often should surgeons scrub, do a hand scrub in between surgical patients? And currently, it's accepted that if you do your hand scrub and you put on a pair of sterile gloves, you can sterilely remove those gloves and put on another pair of sterile gloves and proceed to the next surgery. But if you feel that you've compromised sterility in any way, then the recommendation is to rescrub and start the process over. It's surgeon preference and how well they think they're maintaining sterility. For me, I can probably go about an hour and I feel like I have to rescrub again. So surgical recommendations, obviously, we have to remove the testes and the ovaries. And it does seem that ovariohysterectomy is the preferred procedure in the US, but ovariectomies are becoming a little bit more commonly performed in the US and are very commonly performed in Europe. Pre-scrotal and scrotal approaches for neuters are acceptable. Not many people do a scrotal approach in an adult dog, but it is an acceptable way to neuter a dog. Ventral, midline, flank, and laparoscopic approaches for ovariohysterectomy are acceptable. And obviously, we want gentle tissue handling, meticulous hemostasis, and maintenance of aseptic technique. The guidelines say that either an interrupted or a continuous suture pattern is acceptable for abdominal closure. For me personally, I like using an interrupted pattern because I feel if I use a continuous pattern and that line breaks anywhere along that continuous pattern, then the whole suture is going to be lost. So that's just surgeon preference. Another question that we often get is what to do with fetuses when spaying a pregnant animal. And there's not a whole heck of a lot of research currently about what fetuses are enduring during that process. The options here are to open the uterus and euthanize individual fetuses if they are that far along. We could do an intraperitoneal injection of euthanasia solution through a closed uterus, or just not euthanize the fetuses at all. And one of my very favorite veterinarians who does lots of research on very practical topics is Dr. Sarah White. And she wrote a commentary article in JAVMA called Prevention of Fetal Suffering During Ovariohysterectomy of Pregnant Animals. And here she looked at what research was out there and really tried to assess what is the best option. And the current conclusion is that we don't really know. But the article goes over lots of different fetal consciousness, neurodevelopment, responses to hypoxia, and it helps us as veterinarians make the best decision possible. Okay, so this is what's in that DVD, the pediatrics DVD from Humane Alliance. It goes over various surgical techniques that allow for safe and efficient spay neuter surgeries. And the big four here are modified Miller's knot, a feline ovarian pedicle tie, a figure 8 knot, and an overhand tie. So some of those I remember learning in vet school. A lot of those I did not. And when I got into practice and started working with Humane Alliance, I found that they were more efficient to do those types of procedures, but also I felt more confident in those particular types of procedures. So not only was I increasing my efficiency, but I felt that I was increasing the patient's safety as well. Okay, very, very important. We want to permanently identify animals as being spayed and neutered. I can't tell you the number of times where we'll get a female cat in who I'm not sure if this cat is already spayed. If it was done early in her life, her scar may be very minimal and not able to be visualized very well. And in some cases, we end up opening up those animals to find out that they've already been spayed. And very simple to avoid that. It's costly to do the extra surgery. It's time consuming for your staff, and like the poor cat's got to undergo a second surgery. So very easy to permanently identify animals through the use of a tattoo or ear tips for feral cats. Okay, let's just see if it works. I just don't know how to move that over. Thank you. Okay, so this is a tattoo process called a scoring process. Basically, we make a small incision in the skin. It's not a full thickness incision. We just score the skin. Yeah. So she's making the score. This is on a neutered male puppy, dipping the tattoo ink into the score, folding the skin inward, and placing a drop of tissue adhesive on there. And that's placed near the scrotum and also near the inguinal area so that, yeah, so that if there was ever any question that this dog was cryptorchid, hopefully they would see the tattoo and know that in fact he was already neutered. And the only thing I would change here, I don't like dipping the surgical blade into the tattoo ink repeatedly because it does become unsterile. So a very easy way to do that is to take the sterile indicator strip that you have in the surgical pack, dip that into the tattoo ink, and then use that to run along the score. Thank you. And the next photo that we're going to see is a tattoo, a scoring tattoo that has healed. And that's on a puppy. So hopefully if anybody sees that, it's a big red flag not to be doing an abdominal exploratory looking for reproductive organs. And that's a picture of an ear-tipped kitty. Pretty universal symbol that that cat is already spayed, neutered, and in some places means that that cat has had a rabies vaccination. Sometimes this can be a hard sell to people who love their kitties and don't want their ears disfigured. But it is such a life-saving procedure for our outdoor cats. A lot of cases, they have feral cat organizations will have a relationship with animal control so that if they do see an ear-tipped cat, they won't trap that cat and bring it in for euthanasia. They'll accept that cat as part of a colony that's being cared for and has already been spayed and neutered. Yeah, because it could be from frostbite too. Okay, post-operative care. We want to obviously minimize the risk of complication through vigilant observation of animals in the recovery period and have a quick appropriate response to any abnormal findings. One big post-operative care issue that comes up in a lot of spay neuter clinics that I see are when the veterinarians can leave for the day. In some places, veterinarians want to finish their surgery and walk out the door. And we really have to build into the standard operating procedures that that's not exactly acceptable. Veterinarians are responsible for these patients, and they should stick around at least till everybody is adequately recovered from anesthesia, and then be available to answer questions after that fact. This is just a picture of a litter of kittens recovering. They're allowed to recover together to minimize stress, conserve warmth. Post-operative care, we want to offer a small amount of water to all patients as soon as ambulatory and offer a small amount of food to pediatric, geriatric, and frail patients as soon as possible. Before we release a patient, they should be ambulatory with no signs of distress. If the patient will let you, we should check their surgical incision to make sure it looks good. And we want to go over discharge instructions with the clients, both orally, because some people hear things better, and in written discharge form. So they can take it home, look at the sheet, see if they have any questions. Also, discharge instructions, we strive to have them be in a language that's easily understood by the patient, by the client. Very important for spay neuter programs is that we establish some sort of policy for handling post-operative questions, complications, and emergencies at least within 48 hours following the surgery. And that can be done by a whole bunch of different ways. Staff members can carry cell phones that receive calls and triage those cases. You can have a voicemail that a staff member checks frequently. And for MASH programs, for mobile clinics, super important that you establish some sort of relationship with a local veterinarian or emergency hospital for a recheck of those patients, because you might be 100 miles away the day after you have performed the surgery. Should collect morbidity and mortality data if we'd like to see absolutely zero mortality. But if it does happen, the patient should be necropsied to establish some sort of cause for the death. And also important to identify any trends in deaths that occur during the spay neuter clinic or even after. And that can help you make changes in your program. If you're hearing a lot of patients who are having a surgical site infection or dehiscence or suture reactions, you're going to want to make changes in what you're doing to try to prevent those in the future. Okay, we're going to skip past that because we're running short on time. Okay, so we're going to get to some of the ways that we can deliver spay neuter. And there's lots of different ways to do it. We're going to look at some clinics that are typical of these types of programs. So in MASH style spay neuter clinics, we have people that load most of the equipment that it takes to do the surgery, go on site for a day or two or even more, and then break down the whole clinic and return to a centralized location with the equipment. And I always think that that sounds so time consuming, but I've seen these MASH programs work, and some of them work really, really well and really efficiently. The advantages here are that you can go directly to the area in need. They can have a large geographic radius, and of all the types of programs that we discussed, they do have very low startup costs. And you have the opportunity to minimize your staff levels because largely you utilize volunteers in the location that you're going to be in to help schedule appointments, to help with booking in animals, discharge of patients. So it does have a very large volunteer component. And the challenges here are wear and tear on equipment, wear and tear on your staff because they have to travel so much. You have to recruit a large number of volunteers, and you still need a home base for sterilizing equipment and receiving supplies. So this is a very successful MASH program, Shelter Outreach Services, which is run by Dr. Leslie Appel. Started in June of 2003, and they spay and neuter approximately 10,000 cats and dogs per year. It operates out of central New York State, and it is a pretty large area that they cover. This is considered the Finger Lakes region of New York State. And that's a picture of their van loaded up with all their equipment. They tend to utilize labeled bins so that they can easily transport everything out of the van and into the clinic, and everything's organized for setup. And you can see they have an anesthetic machine that travels with them. There's some brands that are more conducive to traveling than others. In this particular case, they visit shelters, and this shelter has invested in a surgical light and a table which stays on the premise. Okay, we're moving to in-shelter spay neuter clinics. And here the advantages are that the shelter's own animals can be spayed and neutered prior to adoption. We avoid the stress of having those animals be transported off-site for that procedure. And for shelters, this may be the least expensive way to go to have their own animals be spayed and neutered. And they may be able to use that facility for spay and neuter of public animals as well. And the challenges here are depending on where the spay neuter clinic is located, the public may have some trouble accessing it. And veterinary education law in some states says that not-for-profit organizations cannot serve publicly owned animals. So always important to check your state vet med education law before you start engaging in such activities. And very importantly here, you don't want the public animals to be exposed to a possibility of infectious disease from the shelter animals and vice versa. So very important to house those animals separately within the facility. And this is a very successful example of a stationary spay neuter clinic within a shelter. Richmond SPCA in Virginia. They opened in 2002, and they do have separate housing areas for the animals. However, they do utilize the same surgical space. And their goal with 2 veterinarians is to do 65 surgeries a day, and they do that. They accomplish that with a very well-trained medical staff. So moving on to mobile spay neuter clinics. Again, the same as MASH programs, they travel to populations in need. However, this is a self-contained unit. We avoid the constant transfer of equipment from home base to van to site. And some places do use it as a multi-use vehicle that could be used to transport animals, could be used in emergency situations, could be used as an adoption vehicle for some organizations. Of all the clinics models that we discuss, these tend to be the most expensive to buy and to maintain. Your staff either has to be trained in how to drive the clinic or have a dedicated driver. It may be difficult to find a location to park if you need electrical hookups, if you need some sort of water hookup. And if you're limited by the number of cages you have, you may need to park next to a site that affords off-board recovery of animals once they're in a stage where they can be monitored by volunteers. And then we have the additional cost of insurance, fuel. And the model that I'm most familiar with is the ASPCA's mobile spay neuter clinics. We have 5 of them in New York City that serve shelters, rescue groups, feral cats, and more we're serving targeted animal populations that are known to have the most intake at New York City's Animal Care and Control. And that's a picture of one of the units that is about 38 feet long. That's the interior. We have latched cabinets and shelves, drawers so that things don't open and stuff fly out during transport. The shelf area there is used for patient induction. It has its own autoclave, small autoclave, so we can re-autoclave packs throughout the day. And that's the other side of the mobile clinic, which is a surgical suite with a wall-mounted anesthesia machine and also oxygen tanks that are securely affixed to the wall. And the ASPCA is offering mentorship now in mobile clinics, MASH clinics, and in-clinic clinic programs. So any communities that are interested in setting up those programs or enhancing their capacity to perform spay and neuter with those programs, they can come to us for mentorship. I like to call this the hybrid because it is a mobile clinic, but it may have only 2 or 3 cages. It actually is a mobile surgical suite. It's meant to pull up next to a building that has the capacity for off-board recovery of animals. So animals are admitted to the off-board site, they're monitored before surgery, they go and have surgery, and then they come back to the off-board location. And the downside of this is that you have very large dogs that now need to be carried off that unit into the off-board location. But it is a very much less expensive unit to purchase because it's not as large. We only have the surgical components. Okay, I'm going to talk a little bit about stationary spay neuter clinics. And of all the models that we discussed today, this one can focus on performing the largest number of spays and neuters. And although it is a stationary clinic, it can increase the reach that it has in the community by providing a transport system that goes around at certain locations and picks up animals, brings them back to the stationary spay neuter clinic. Startup costs tend to be higher. Startup time can be much longer. And I've heard of lots of communities that have difficulty with compliance issues with building and maintenance requirements and zoning laws. And in Buffalo, when we did this, we had ideas of where we wanted the clinic to be. We went down the path of talking with owners of the buildings to see what we could get the building for, if we could renovate it. Ultimately, we found that it wasn't zoned appropriately. So we wasted a whole lot of time doing that. So what we did instead was go to the towns where we wanted the clinics to be, look up the streets that were zoned properly, and then go hunt for buildings in those locations. And that's ultimately how we found our space. The premier example of a stationary spay neuter clinic is Humane Alliance, and they're located in Asheville, North Carolina. They're established in 1994, and they sterilize about 21,000 cats and dogs per year, and they do use an extensive transport system. Has anybody been to Humane Alliance? If you have the opportunity to go, definitely worthwhile. They have a huge renovated building. They're always expanding. And they have six surgical suites, each with 2 surgical tables. So that when the surgeon is done with one animal, they reglove, they turn around, and they start the next patient. And then each surgical suite corresponds with a prep area that also has 2 surgical tables. That's the area of Western North Carolina that their transport system covers. And they have a highly successful mentorship program whose goal is the nationwide strategic placement of targeted, high-quality, high-volume spay neuter clinics. And they offer assistance, comprehensive assistance with floor plan, budgeting, surgical training for veterinarians and also veterinary support staff members. They even help with selection of computer software, and they also assist with anesthetic and analgesic protocol selection. That's a picture of where their clinics are located. As I looked up last night, as of April of 2013, they have 140 clinics either established or pending throughout the United States. And the Humane Alliance has a very successful externship opportunity for veterinary students. Not only do you learn to perform high-quality, high-volume spay neuter, but you also get a more global perspective of disease control within such environments, patient assessment. You will participate in patient preparation, also record keeping, patient monitoring. And really important for students is that they provide housing for free. Yep. Yep. And also they may have some increased capacity coming along. So if you're told that now, always check back in the future to see what their capacity limits are. Other spay neuter externship opportunities can be found at sheltervet.org and also Humane, what is now called Humane Society Veterinary Medical Association Field Services Program, formerly called RAVS, which you can go on their site and see what externship opportunities are available. Okay, our last slide, non-surgical sterilization. There's a great organization called Alliance for Contraception in Cats and Dogs, and their goal is to encourage, promote the development of non-surgical sterilization and contraceptive methods. They also keep a very close eye on what research is being done. They try to summarize that research for veterinarians, and they also have a very comprehensive review of Suturin, which is created by Arc Sciences. It used to be Asterosol, it used to be Nutersol, which is a chemical sterilant for male dogs. It's a drug that is injected into their testicles, which renders them chemically sterile. So if you have any questions about that drug, very good to go to this organization to learn more about it. It is expected to come out in the US later in 2013, but unfortunately the company has made those promises several times in the past, and it has not come out. Although through their training, you can gain access to the drug, and some veterinarians are using it successfully. So I know we have like 1 minute left. If anybody has any questions, it'd be great to hear them. Yes. I don't need people. Yeah, the question is the pros and cons versus doing ovariectomy versus the full ovariohysterectomy. And again, surgeon preference. Some people believe that doing the ovariohysterectomy is actually easier because you have 3 sites in which to place ligatures. If you're doing just the ovariectomy, there's 4 sites in which you have to place ligatures in order to get the ovaries out. So some people feel that it's actually extra work to do the ovariectomy. Some people feel that they can make a smaller incision if they're just focusing on getting the ovaries out. Other people don't have that problem. The incision's the same one way or the other. And and I've thought of this too, but if you leave the uterus in, you don't have the estrogen influence to create pyometra. So technically, you shouldn't be seeing pyometras in those cases. I wonder if that has been studied long term. It will be interesting to see of the cases that we're doing ovariectomies in, if any sort of uterine infections or uterine problems down the line develop. I have not heard any studies on that. And ovarian remnant, there are some studies on ovarian remnant, but I don't know if it has any changes in the occurrence in those patients that you've referenced. Yes, and ovarian remnant, I've had ovarian remnants occur largely in cats. In dogs, it seems that their ovaries are encased in fat. So if you feel the ovary and get all of the fat that's surrounding them out, chances are it's less possible to leave an ovarian remnant. In cats, though, sometimes they have cystic ovaries, and I fear that when I'm removing the ovary, that cyst may break open and leave some ovarian cells within the abdomen, or a little chunk of ovary in the abdomen, and later that becomes revascularized and ultimately sets up production of estrogen. So I think that it's just being really super careful in any patient that you do the surgery in to remove all of the ovary and try to limit any sort of chance for that ovary to break apart in the abdomen. The presentation tonight is going to be slightly different topics. We're going to go more into pediatric spay neuter. We're going to look at providing spay neuter specifically for shelter animals, and sometimes that can cause a bottleneck in how they proceed through the shelter and get out in an efficient manner into their homes, and also providing spay neuter at an appropriate age for owned animals. That's about it. You're welcome. Thanks for being such a great group.
Michelle, Megan, Humphrey, and